"15 foods to eat in case of type 2 diabetes." Type 2 diabetes represents 90% of diabetes cases. Diet plays a key role in people suffering from this disease. It must meet nutritional needs, control blood sugar and lipid levels, and help maintain a healthy weight and prevent cardiovascular disease. Without forgetting that the consumption of water is essential for the transport of nutrients and the elimination of waste, including and especially for a diabetic. Drinking at least 1.5 liters per day is necessary for the proper functioning of the body. So here are 15 foods to include in the menu in case of diabetes, in addition to a healthy and balanced diet and regular physical activity. On this channel, we approach health from a global point of view, working on the 4 pillars of health: diet, physical activity, mental health and sleep. If you are not yet a subscriber to the YouTube channel, Top Fitness Health, consider subscribing, and if you want to be notified when a new video is released, consider activating the little bell. 1. Pears offer many phenolic compounds, including flavonoids, responsible for the color of the fruit, and phenolic acids. Present mainly in the peel of the fruit, these components neutralize free radicals, thanks to their antioxidant effect. Phenolic compounds thus contribute to the prevention of cardiovascular diseases and certain cancers. The high dietary fiber content of pears also helps reduce the risk of heart disease and regulates intestinal transit. The soluble fibers contained in pears delay the absorption of glucose in the small intestine, thus allowing a better control of blood sugar levels. People with type 2 diabetes must monitor their blood sugar, glucose, level to avoid hyperglycemia. If blood sugar levels are high, the person may experience symptoms such as constant urination or thirst. 2. The avocado is an excellent food choice since it is highly antioxidant. Its TAC, total antioxidant capacity, index is 1,933 micromoles per 100 grams serving, which measures the overall antioxidant activity of a food or plant. This measurement allows to situate the antioxidant activity of a food on a scale from 0 to 14,000 micromoles. In case of diabetes, it is important to consume foods with a high antioxidant power because this disease favors the activity of free radicals responsible for the oxidation of the body. These can lead to glycation, equals reaction between excess glucose and body proteins, which is one of the factors of accelerated tissue aging. The avocado is also a fruit rich in monounsaturated fats, also called good fats. A study has shown that the avocado has a real impact on the reduction of blood lipids. That makes it possible to prevent the risks of cardiovascular diseases, which are from 2 to 3 times higher in a diabetic person. 3. Barley is a highly nutritious whole grain product, rich in soluble fiber and vitamin E. This cereal is an antioxidant that helps fight against damage caused by free radicals. Vitamin E helps prevent the risk of cardiovascular disease, certain cancers and other diseases associated with aging. In addition, this cereal has a low glycemic index, equal or lower than 55. 2 meta-analyses have concluded that taking the glycemic index into account has many benefits: lower blood sugar levels, more effective metabolic control and lower lipid levels. These indicators should be taken into consideration because they can counter or reduce certain effects that may be associated with type 2 diabetes, hyperglycemia, metabolic syndromes such as abdominal overweight and hypertension, and also increased risk of cardiovascular disorders, etc. 4. Salmon is an oily fish that has an excellent source of omega-3, whose impact on reducing the risk of cardiovascular disease has been demonstrated by numerous studies. This type of fatty acid helps reduce blood pressure, blood triglycerides and blood clots. Salmon is also an excellent source of complete protein. It is advisable to include fish protein in your diet as it is believed to improve insulin sensitivity. Type 2 diabetes causes resistance to insulin, a hormone produced by the pancreas that promotes the absorption of glucose into cells and regulates blood sugar levels. In insulin resistance, too much glucose is in the bloodstream, causing high blood sugar levels. 5. Broccoli is a vegetable of the cruciferous family. Whether eaten raw or lightly cooked, it contains a lot of vitamin C, which has been shown to have preventive properties against certain cancers. Daily consumption of broccoli is linked to a lower concentration of homocysteine, an amino acid whose increased content is proportional to the risk of cardiovascular disease. Two of its components, lutein and zeaxanthin, have antioxidant properties that also fight against cardiovascular disorders. 6. Sweet potatoes, in addition to their exquisite flavor, are high in antioxidants, thanks to the anthocyanins and carotenoids they contain. The purple sweet potato would be particularly rich in anthocyanins, hence its coloring. Moreover, the darker the flesh, the higher its concentration of antioxidants. This component reduces the oxidation of bad cholesterol, thus preventing the risk of cardiovascular disease. The sweet potato with a white skin would have the effect of reducing insulin resistance, which would help control blood sugar levels. 7. Olive oil, Olea europaea, is a functional food, which not only has a high content of monounsaturated fatty acids, but also contains components with interesting biological properties. One of them is oleic acid. This acid has been shown to improve insulin production in vitro and in vivo. Therefore, a diet rich in oleic acid can be very beneficial for diabetics. In women, the consumption of olive oil is also associated with a lower risk of developing type 2 diabetes. Regular consumption of extra virgin olive oil is a good alternative to the treatment of diabetes mellitus because it does not contain carbohydrates, but it can also help prevent or delay the onset of the disease by avoiding insulin resistance and its possible consequences, by increasing the level of good cholesterol. It allows a better control of glycemia and a decrease in blood pressure. 8. Legumes. Rich in fiber, vitamins, and minerals, legumes could help prevent type 2 diabetes. In addition, in diabetic patients, they can help maintain glycemic balance because it limits the increase of sugar in the blood. Researchers believe that the highest consumers of vegetable proteins are thus the best protected against the risks of diabetes. 9. Garlic, Allium sativum, like onions, is rich in sulfur. Among its therapeutic virtues are its positive effects on diabetes and its ability to prevent atherosclerosis and renal failure in people who already have diabetes. The hypoglycemic activity of garlic is potentially due to the increase in insulin secretion by the beta cells of the pancreas. 10. Ginger, Zingiber officinale, is particularly interesting in the prevention of complications related to diabetes, complications of the liver, kidneys, eyes and nervous system. Numerous studies indicate that ginger extract inhibits certain enzymes needed to digest carbohydrates, alpha-glucosidase and alpha-amylase, thus reducing the absorption of carbohydrates in the intestine, and therefore the need to secrete insulin to regulate these carbohydrates. The anti-diabetes effects of ginger also go through a complex pancreatic mechanism. But a recent study shows that daily consumption of ginger significantly lowers blood glucose in patients with type 2 diabetes, as well as their cholesterol, LDL cholesterol and total cholesterol, and triglycerides. Ginger also reduces kidney failure resulting from type 2 diabetes, nephropathy, as evidenced by a decrease in proteinuria, protein in the urine, in those who consume it. Ginger can also have positive effects on erectile dysfunction sometimes encountered by diabetic patients. 11. Turmeric, Curcuma longa, like ginger, can be used in the prevention and improvement of type 2 diabetes. Indeed, this Indian spice not only has a well-known anti-inflammatory and anti-cancer action, but it also regulates insulin resistance, improves the function of pancreatic beta cells and promotes good intestinal absorption of food. The efficacy of an alcoholic extract of turmeric was tested in a randomized, double-blind, placebo-controlled clinical trial conducted over 9 months on 240 patients. The results of the trial show an overall improvement in pancreatic beta cell function. 12. Cinnamon, Cinnamomum zeylanicum, which is less expensive than saffron, is a known star in diabetes management. Long used in alternative medicine, it prevents insulin resistance and helps the liver to regulate the proper synthesis of glycogen, the sugar stored in our liver. In addition, this sweet-smelling spice boosts the body's insulin effects. Insulin resistance is common, in residual form, in many people. It affects up to 95% of obese women. A recent study confirms that cinnamon can be very beneficial for women with insulin resistance. Cinnamon is found in combination with fenugreek and other nutrients, chromium, vitamins B, etc., in vitamin and mineral-based food supplements. 13. Grapes, Vitis vinifera, also contain many polyphenols such as resveratrol, quercetin, catechins and anthocyanins, all of which have been shown to decrease hyperglycemia and improve the function and protection of pancreatic beta cells. Since grapes contain a lot of sugar, 18 grams of carbohydrates in 15 grapes, and a high glycemic index, use them in moderation and choose fresh whole grapes rather than raisins or grape juice with a higher glycemic index. Eating the skin and seeds is necessary, as this is where the most resveratrol is found. To take advantage of the benefits of resveratrol without the glycemic load of the fruit, if your current glycemic parameters are really bad, it is also possible to take resveratrol in the form of a food supplement. A study on type 2 diabetics shows that after 4 weeks of taking it, the insulin resistance index decreased, as well as the glucose level 35 minutes after the meal. 14. Watermelon, Citrullus lanatus, is rich in another nutrient. L-citrulline is a precursor of the amino acid L-arginine. The latter limits the metabolic effects of high glucose levels in diabetics and prevents the renal damage of diabetes, glomerular nephropathy. Another study shows that watermelon juice consumption increases arginine availability, improves serum arginine concentration and induces hypoglycemic and hypolipidemic action and decreases oxidative stress. 15. Blueberries, Vaccinium angustifolium, full of anthocyanins, are very useful in the prevention of diabetes. It has been suggested that anthocyanin may play an important role in improving the symptoms of high blood sugar. A study on 32 diabetic and obese participants shows that daily consumption of bilberry improved and increased insulin sensitivity and decreased blood glucose concentration. Some varieties may also have an insulin-mimicking effect by acting on the beta pancreatic cells. If you are not yet a subscriber to the YouTube channel, Top Fitness Health, consider subscribing, and if you want to be notified when a new video is released, consider activating the little bell. See you soon for more videos. And until then, take care of yourself.